Courtney. I'm Dr. Leah.
This is Dr. Sylvia.
And we are
Three Friends Talk.
Hey!
Hey, ladies.
It's Wednesday night. You know what that means. It's another episode of Three Friends Talk.
Hey.
Yes, we're live on Facebook at 8 p.m. Central, 9 p.m. EST every Wednesday night. Make sure you subscribe to us on all of your streaming platforms, okay? Wherever you find podcasts.
Mm-hmm. And for all of our friends, hello. It's so nice to see you. Once you subscribe, make sure you leave us a 5-star review. Hey, friends, where are y'all checking in from tonight? Let me see it in the comments.
Like my little bop there.
Is it bounce?
I'm getting ready for New Orleans. Y'all know I'm ready to go home.
Okay.
Aww.
Why? Did you ask why? I thought you did. No, you didn't ask. I'm getting ready for New Orleans. Y'all know I'm ready to go home.
Oops, my bad.
We're getting ready for homecoming. That's why. Getting ready to go back to New Orleans.
Oh, homecoming.
Yes.
I'm so excited. Let me share this real quick.
What you sharing, girl?
The show.
Okay. Yeah, I just did that as well. Hey, new friends. If we got some new friends that are tuning in for the first time, let us know in the comments. It's good to see you.
So
what you got, Dr. Sylvia?
Xavier's University homecoming is next week. I threw a little I'm not gonna say wodicent. I'm gonna say accent on it because I'm trying to be better. When you know better, you do better.
Mm-hmm.
I threw a little accent on it. We're excited, y'all. We're gonna be live from Gold Table Talks Thursday at 3 p.m. CST, 4 p.m. CST. Should we go live on Facebook, y'all? What y'all think?
Yes. For all the people that that could not be there, because we know that registration is now closed. So if you weren't able to get your ticket, you should be able to still catch our show streaming on Thursday afternoon. So, but for those who are going to join us, we can't wait to see you live and in person. And for those because there's a virtual option too. So if you signed up virtually, you'll be able to stream it from Xavier's platform.
But before next week,
yes, Dr. Sylvia.
Oh,
what's before next week? Hey, that reminds me.
This year Halloween fell on a weekend.
Okay,
it is. Oh, you stopped it real short. Just
here's some expletives. So this year Halloween's on a weekend. Who's dressing up?
Dr. Courtney, you dressing up?
Oh, my costume is a surprise. No. You have to wait.
Oh, it's a surprise. Okay.
Every year it's a surprise.
Can you give us a hint?
It's a villain. It's a villain. I will be dressing up as one of my favorite villains.
Disney villain, Marvel villain.
Will your pronouns change?
No.
Okay. Back to my question. Disney villain, Marvel, what's
DC.
It is a Disney villain, yes.
Okay.
Is Chucky Disney?
No. Sylvia, what you gonna dress up as? Nah, okay.
I have some cat ears. I'm not really that Halloweenish.
I'm not dressing up. I believe Jalen is dressing up on Friday. They had their last home football game, and he already.
Well, at least he's still in the spirit.
He borrowed my scrubs. I gave him my jacket from pharmacy school. So I don't know.
So he's just gonna dress up as a pharmacist.
I guess.
Yay!
I love it.
But I mean, I heard a lot of teenagers don't like to, dress up. So I'm happy he's still in the spirit of
he
dressing
dresses up every year, just about.
I have an 8-year-old, so my son picked my outfit and was like, "Ma, I'm gonna be this, you gonna be that," and I was like, "Okay."
So is his costume coordinated with yours?
Not at all.
Not
at all.
Oh,
Not at all.
I thought it was a theme.
Yeah.
I tried to, coordinate, but
does Mr. Jones dress up? Mr. Jones dress up?
Yes. And guess what he's gonna dress up as?
Is it coordinated?
Wait, you gonna tell us out? You gonna tell us
yes,
but not
I'm gonna tell you what Mr. Jones is dressing up as. So has everyone seen Squid Games on Netflix?
I have.
Yeah.
So he's gonna dress up as the head man on Squid Games.
The old man?
I said the front man. Excuse me, the front man.
So he's gonna have
the one that got slapped.
No, not the main character. The front man, Sylvia.
He's gonna have like with the he's gonna have one of the robes and the mask.
The brother.
Don't tell it the
show. My brother's friend.
Spoiler alert.
Exactly.
It's the man with the black mask who was the front man.
Got it.
Okay.
I called him a brother because he's black. Got it. Just go with it. Okay.
Yeah. So what's next?
What games did you watch, Sylvia?
No,
y'all? Okay, this is the big debate. Did you watch it dubbed, or did you watch it? Did you watch it in Korean, or did you watch it dubbed with the subtitles?
I watched it where it made them look like they were talking in English, but I knew the mouths. The mouth
they say it's
was
a totally
off.
different. It's a big debate about that. The creator
it made it look really goofy in the first episode. So
I was
like, I'm not watching this.
Sometimes they would be speaking English and the subtitle said something totally different.
It did, and I'm like, that ain't what they said.
They say that you have to watch it in Korean with the subtitles because it's a totally different experience.
I think
I'm not watching it again.
It's like that with a lot of it's like that with a lot of them. They have to have the interpretation because I just finished Money Heist, and Money Heist was the same thing. It was in don't give me the line. I think they were in Spain.
They're in Spain.
Yeah. Mm-hmm. So everything was
most of them talking in English. And
no, it was not.
I thought it was funny.
They were talking in Spanish in the actual movie.
Oh well,
on the actual show.
Maybe I didn't notice.
Anyway, what else is new?
So okay, Dr. Courtney.
I'm sorry,
Dr. Courtney. Yes. Dr. Leah and I were speaking earlier, and we had this debate about homecoming.
Okay.
So, what were you saying, Dr. Leah?
Spit it out. The show is only an hour.
I need something else in my cup because she getting on my nerves.
Oh, you want me to tell it? Okay. She said that she was just reflecting on some of the homecoming events that we're planning to go to next week. And she said, well, if you're a student, it shouldn't be called homecoming. And I was like, yes, it should.
You're already at home.
Mm-hmm.
But like they have the homecoming.
You're not coming back.
They have the
We're
homecoming.
Coming back.
They have student homecoming. Like they have the coronation ball with Miss Xavier. So it's a whole,
different experience. Mm-hmm.
I told her that when we were students at Xavier, I don't remember going to any homecoming events except the boat ride.
And I told her
but
that
you
was
gotta
not
remember,
true.
Homecoming back then wasn't.
Let Dr. Sylvia continue.
That was not true because I was on the homecoming committee and I was over jazz night. And that picture that we had recently with Dr. Jamie, our super friend, that was taken at jazz night because that's the outfit that I wore. And she said, well,
20 years ago?
It was. Mm-hmm. And I still remember.
Okay.
Praise the Lord for memories. And I told her that we had jazz the first hour and then spoken word as well. And I think that was the last time
That's what I said. I said, you allowed spoken word? Is the debate
that it should still be called something different?
What the conversation started because there are schools that are having homecoming, but they aren't allowing alumni to come back on campus. So I was like, that's not a true homecoming to me.
Tuskegee.
Yeah, that's one of the schools.
Yeah, but it's more than one.
I just felt like
that's whack.
So she said,
so they have something
it's
else.
safety. It's for safety.
Yes,
correct.
I understand, but it's not the same experience.
So
So
she
are
said
you
it shouldn't be
saying
called
that
homecoming.
they should call it something else if you're not going to let alumni come back?
Right.
What they don't come
It's a
back
fest.
game? It's the homecoming
It's a
game or
it's a
the don't
fall
come
fest.
back game? What are you gonna call it?
You talking about the game?
Homecoming
Spirit
game?
Week. Spirit Week.
We still have a game. It's just basketball instead of football.
Spirit Week.
Courtney,
It is
Courtney
Spirit
is in
Week.
outer space right now.
Spirit Week.
I like Spirit Week, but it's
I
only
do
a
too.
homecoming if you allow people
Spirit
to come
coming.
back home.
No.
I agree with
Spirit
Dr.
Week.
Leah.
Spirit Week game. No, it's
Or
whack.
fall festival.
Just call it homecoming.
Fall festival.
That sounds like you're gonna pick pumpkins and leaves.
Oh,
Okay. So, did y'all catch the premiere of Insecure?
Yes, I thought it was okay. So from how the
all in the news.
What? Just tell us how you thought. Go
right to it.
No, start to tell us your impression.
Okay, so I wasn't wowed by the first episode. I really wasn't. I'm expecting a lot for this to be the last season of Insecure. So I wasn't wowed by the first episode. And I did forget that they went to Stanford. And I had to really ask my cousin, remember Dr. Janice Faye, who was on there? I was like, did they really have a thriving like Black community like this at Stanford? And she was like, oh yes, it was lit, right? So you can ask BJ, my cousin, who's Stanford.
Yeah. And our former intern Janae goes to Stanford right now. She's actually a Stanford AKA. So we'll get into that. But they have a whole community of
let's
dorms
talk about
called like Ujima or something.
You brought up AKA. So we're all Greek girls. So there is a conversation going on right now about, how the AKAs did not appreciate Amanda portraying or saying that she was an AKA. And again,
I don't think it's
playing
saying.
a role.
I think
she's an actress. Her character was an AKA. But Amanda was like, hey, it's still fiction. It's not real, people. And I have my own viewpoint on it. I'm a Delta. As you know, Dr. Sylvia is a Zeta. Dr. Leah is our AKA. So, Dr. Leah,
can I just say something?
Yeah, I think we can all weigh in on it.
Is the issue that she's an AKA, or is it the issue that she was wearing letters and
she was not one?
In the shield. So I think that's two different things.
But she didn't wear the shield.
I didn't see a shield.
There was no shield. All you saw was
an A. It was covered up by the hair. I didn't particularly notice it.
They made sure not to show it.
No. I saw just the A and the K. I didn't see the
bottom. I
didn't even see a K. All I saw was the
A and a K.
I saw A and a K, Courtney.
But I must have blinked. Because all I saw was an A. So, Dr. Leah, I would like to know what your thoughts are first. I'll give you the floor, Miss AKA. Yes.
And I will take the floor, and I will follow protocol, and I will not discuss.
As an official AKA, yes, she is following the rules.
Active. Financial.
Well, I'm DST, so I'm going to go ahead and say what I
Go ahead.
So, I'm not going to say I don't think I'm not in an uproar as a lot of the comments that I've seen are commenting on. I do believe that her wearing pink and green, her character wearing pink and green, and just having the A on, I think I would have felt different if it was like the crest or what have you. So if it was DST, I don't want nobody. You can't wear none of my stuff. If the actress is gonna have on red and white, I don't know, and show a D, would I be offended?
And we do know that this has been stated in previous seasons. Everyone knows that, right?
Molly and not Amanda.
But
Molly
you can't have on my official crest and Greek letters.
Tiffany
are both AKAs.
Sorry.
Correct. And they have greeted each other in Ski Week before, and Molly has an AKA cup and all. I guess
I think the real issue here is that they were being worn. They were adorning her body.
Right.
Adorning her body. Yes, all of
the letters that and
letter.
It was two. I feel bad for Amanda because she is an actress portraying a role. The costume designer came out like she was like, "Come for me, not her."
So here's a comparison. It's more like, there are people who, are in movies on biographies of people, right? They they may have someone who's Caucasian to play a Latino role. There are people of different nationalities that play different nationalities, right? Not the same nationality. So it's almost like a line has to be drawn. So if they're an actress or actor portraying someone, how much of them can you imitate without crossing the line of being rude and disrespectful? And she didn't wear it in a rude and disrespectful way. Like, she was not acting out, trying to be in a negative light about it,
Mm-hmm.
So I do believe that there is a line that cannot be drawn when it's imitating something that you're not.
They were saying more stuff negatively about the Omegas in the episode than they did the AKAs. And I mean, let's just call a spade a spade. AKAs are pretty lit right now. Vice president. It's a lot of great things going on for all Greeks. But I mean, we've never had a Greek be vice president. So I do think it was meant to honor that. I don't think it was meant negatively, but I understand too. Somebody said online, she got to wear the same itchy pantyhose and all white that I wear to wear our letters, So I definitely get both sides. I think the corporate letter, I just think there's a way to handle things.
Don't get me.
Again, I think there has to be a line.
Think it should play out
you cannot
online.
Cross the line.
I was to a certain point outraged about the fact that a letter from corporate was leaked on social media than I'm outraged about some pink and green and an actress portraying an AKA. I was more outraged about that. I will say that.
Say that.
Brian just commented, so wait. Have you seen? I don't think he's seen the episode. I asked him that the other day. So wait, they are upset at her for wearing AKA apparel in a show, but she isn't actually an AKA in real life. Correct.
That's correct.
But Ghost from Power, what's his name?
We know who you're talking about, Ghost. That's the name.
Him.
He's an alpha, but he's about to play a role of Omega. And he got the Omega brand on his own.
Oh, I think I heard about the
line. You know what I'm saying? It's got to be where if she was in that position and she was representing in a negative way, that's one thing. Or these official Greek letters and symbols like crest and Greek letters. I mean, there is a certain line that you don't cross. Okay,
right. Or you get permission.
Or at that point, it's like, no, we're not going to get permission for that. That was
another reason why I believe there was uproar. But I believe the uproar was before there was even, if it was even known if it was unauthorized or if there was an official.
And I just think we all have emails that we can send to our respective sororities. I just hate the way it's playing out online because Greeks, the National Panhellenic Council or member organizations do a lot of good in our communities. That's correct. This is kind of overarching and it's not a great look.
It should not overshadow. It really should not.
Yes.
But yeah, I really wanted to know your thoughts on it. And I think this is a great platform for us to talk about it because it's relatable, for us. And just thank y'all for sharing. Thank you, Leah, for sharing as much as you could.
Mm-hmm.
So
protocol.
So it is still Breast Cancer Awareness Month
and American Pharmacist Month. Okay.
And Dr. Courtney said that. And we're bringing you all pharmacists all month. So this is the last Wednesday of the month. We're bringing you another amazing pharmacist. What you got, Dr. Leah?
American.
We got a super friend. Yay.
Y'all ready?
You dancing? Yes, I'm ready.
You need some music?
I need some music, girl. See, I'm trying
to dance to her own tune.
No, I was putting my banner for American. It's my last time I can put American Pharmacist Month at the bottom of the screen. I just want to keep it on there a little longer. That's all.
Got it.
Yeah. Okay. But yeah, let's hop right on into this guest. How about that? Y'all ready?
We're ready.
Y'all ready for it? I am ready for it too. So, it's October. We also celebrate. Um, there are a lot of people that have breast cancer. Are breast cancer survivors. Um, know someone that has had breast cancer. So we talk a lot about that in October. We wear pink, we acknowledge them. We talk about the people that we've lost and what we've learned. So I thought, I talked to Dr. Courtney and Dr. Sylvia. I was like, I want to bring on someone who knows about oncology or, dealing with different cancers. And we found someone. So coming to the stage.
Hey.
She is a clinical oncology pharmacist at the Miami Cancer Institute. She graduated with a PharmD degree from Palm Beach Atlantic University and afterwards completed her postgraduate residency training at Cleveland Clinic. Outside of helping cancer patients on a daily basis, she enjoys blogging and teaching the next generation of pharmacists. I like that. She's also the founder and creator of a wonderful brand, and we're going to talk more about that later. It's called MsRxGeek.
Hey.
Where I know, I love it. Where she inspire, motivate, and teach those who are passionate about the field of pharmacy. So tonight we are introducing to everyone Dr. Aisha Shokoya.
Yay!
Welcome to the stage.
Welcome, Dr. Aisha.
Thank you. Thank you. So happy to be here.
Hello,
Thank you for having me.
Thank you for being our fourth friend tonight.
All the way from Florida.
Yes. Sunny.
How's the weather?
Y'all just about to say, is it sunny? How is it down there?
The weather is great. It's great. It's lovely. I mean, the only thing that, I get sad about during this time of year, we don't see the transition of fall and winter.
Yeah, I never thought about that.
Unfortunately. So it's kind of hard to be in the holiday spirit, but we try our best.
Right. Well, we miss that beach life, but we will live vicariously through you right now. But
you guys are always welcome.
Thank you.
Oh, thank you. Thank you for
Thank you.
Let me pack a bag.
Okay. I know.
Exactly. So
I guess a good sweater.
I guess before we get into like the nitty gritty, Dr. Courtney, would you like to play a game? Have we played a game of this or that yet in season 3?
I'm ready.
I'm ready.
Okay, so Dr. Aisha, this is the part of our show where I like to play a game with our super friend. And it's actually going to be a lot of fun. There's no pressure, but I'll give you a few options. And the first thing that comes to mind, just blurt it out. And we're going to try to beat the timer. So Dr. Leah is my timekeeper. And we're going to try to fit in as many questions in 30 seconds as we can. Okay?
All right. Sounds good. I'm ready.
All right. Dr. Leah, are you ready with the timer?
Ready.
All right. When I say go, hit the start button. Un momento. Okay. And go. iPhone or Droid?
iPhone.
Woo-woo.
Heels or flats?
Flats.
Vacation or staycation?
Vacation.
To attend a party or host a party?
Attend a party.
Text or calls?
Text.
To see the future or change the past?
See the future.
To have a rich friend or a loyal friend?
Loyal friend.
Introvert or extrovert?
Introvert.
Love or money?
Love.
Coffee, wine, or Hennessy?
Wine.
I think about that. We got them all in.
How does the
game?
That was really quick. I thought that was it.
How does the game become
that
about
was 30 seconds?
Her beating the buzzer?
It was 30 seconds, and we got all my questions in. Yeah,
awesome.
Great job.
See,
Great
not
job.
bad. Not bad. I tried to switch it up a little bit.
And that was cool.
With the attend a party and host a party, I really, I'm always the hostess with the most.
Okay, great job. Great job.
Pat yourself on the back, girl. Get yourself your flowers while you can.
So, Dr. Aisha, can you tell us what is a clinical oncology pharmacist?
So, as you know, as pharmacists, we're already medication specialists. So, oncology is just taking it, a step deeper, where we specialize in everything relating to oncology. So we're well versed in chemotherapy, monitoring patients on chemotherapy, managing patients on chemotherapy. We provide recommendations to the providers, in light with the guidelines, whether there needs to be dose adjustments with different chemo. Um, there, it's so much. I feel like oncology is a whole other world of pharmacy.
We
Hard
agree.
to describe.
It really is.
We agree. I knew that I was not interested in this path when I got a C on my oncology exam in school. So I have a ton of respect for how it's just a whole nother level.
Yes, yes. I remember actually when I was in pharmacy school, everyone looked at me like I was crazy for being interested in oncology. They're like, why? Why do you want to go into oncology? Doesn't make sense. I'm like, I want to do it.
You knew early on. That's awesome.
Yes, I knew early on.
Well, we definitely want to talk to you because it is Breast Cancer Awareness Month. And
Yes.
I think cancers in general get grouped together, but a person like you knows which meds are good for what type of cancers and the dosages. And, it's so much to keep track of as an individual patient. So I can only imagine keeping all of that straight as a clinical oncology pharmacist. So
it's tough because the guidelines are always changing. There's always new medication approvals. Things are always changing in the oncology world. So we have to be on top of it as much as possible.
Right. And I'm a specialty pharmacist. I don't know if I that earlier when we
that's awesome. We love our specialty pharmacists.
Oh, wonderful. Yes, ma'am. But I've been in practice for 17 years. So imagine when I first came in, it was, you had these medications and you had this group for this and this group. And so now we have, generics coming out, and it's just like, it's all, like you said, it's very overwhelming.
Yes.
So it's just, so much has changed.
So much has changed. It's crazy.
So you said something I wanted to ask. You said you knew early on that you wanted to go into oncology, but was there something behind that? Why oncology, and what made you decide that amongst other, specialties that pharmacists could have gone in?
So there was a couple different factors. I mean, there's obviously the cliche one of having cancer as affected members of my family, very close family friends. And, one of the reasons why I even went into pharmacy in the first place is to be able to make a difference in patients' lives. Mm-hmm. And I feel like oncology is an area where pharmacists can have the most impact. Because at the end of the day, the hallmark of cancer treatment is the drugs. It's the chemo. So targeted agents, and pharmacists as a medication specialist, we have the ability to have a great impact on patients' lives in that area. So I knew for sure like this was something I wanted to go into, and it was challenging. I love challenges. Mm-hmm. So yeah.
Okay. Awesome. All right. And so after pharmacy school, what additional studies did you have to finish or complete after that?
So after pharmacy school, I knew I wanted to do a residency. The residency was the first step to get to my goal of becoming an oncology pharmacist. So when I was looking for residency programs, I was looking for programs that could kind of tailor the program to my interest of oncology. So luckily with my PGY1 at Cleveland Clinic, I was able to do projects and my research focused on oncology. I was also able to develop a protocol and a practice model for having a pharmacist heavily involved with oral chemotherapy as well. So that was very helpful. Mm-hmm. And fortunately, after I finished my PGY1, I was able to accept a position as an oncology pharmacist at a large cancer center down here in Miami.
Nice. All right. Thanks for sharing.
Mm-hmm.
I'm going to be quiet. I'm going to pass it to Dr. Leah because I could go on and on.
No, it's very inspiring.
Okay, I saw their faces. And I was like, but anyway. So as I mentioned, you have a brand. So tell me about the brand. Tell us about the brand. Tell us when did you come up with it? Is it fairly new? What exactly do you do with your brand?
Yeah, so this brand has been evolving over the years, but initially when I started it, it was back in 2017. I think I was a P3, so I was in my third year
okay.
of
You were in
pharmacy
pharmacy
school.
school. Okay.
Yeah, and I wanted to have a platform to help engage and motivate, inspire other individuals who are passionate about pharmacy. So this would include people who are already in the field of pharmacy or those who are possibly interested. Or people who are just curious about what pharmacists do. So I wanted to use my platform to educate not only pharmacists or anyone involved in the field of pharmacy, but even people in other professions, just to highlight the role of a pharmacist, what is our contribution to the healthcare team, and also to provide education, not only clinical education, but career education, advice, to a large audience.
Awesome.
But it's evolving. Right now, I'm actually working on creating a podcast.
Yeah, we were going to talk about that.
This is great practice.
Okay, and it's called MsRxGeek. So I guess I was kind of curious, like, do you have like maybe any pharmacy students right now that like reach out to you or you mentor or anything like that?
Yes, I actually have students that reach out to me all the time. It's always funny when they recognize me in person.
Oh wow.
Because I'm kind of shy. So when they do see me in person, they're like, Are you Miss RX Geek? And I'm like, oh my God. Yes, I am. But it's great because they come up to me and they're like, you helped me pass my NAPLEX. Your guide was amazing. I have to thank you so much for your content. You've helped me get a residency. And it was just a reminder of why I even started the brand and why I'm doing what I do. So it's great to have people provide that feedback to me.
That's awesome. Isn't it amazing, y'all, in the world of social media and having someone that you can reach out to that's in a similar situation that you're in? It's like, what do we have, y'all?
I have a testimony. I got a testimony to that. So I have an aunt who has cancer, and she's been in remission, and we're making sure that she stays that way. So she's for the rest of her life, she's going to have to go undergo treatments to make sure she stays in remission. So she reached out to me asking questions about some of the medications. And as you stated earlier, Dr. Aisha, oncology pharmacy is a totally different world from regular pharmacy or what I'm doing right now, managed care. And that's a compilation of all types. Oncology pharmacy is not one. I can tell you about opioids, behavioral health, med adherence, CMR. I could go on and on. Oncology is not one of them. So it's good to know people because Dr. Aisha, right at my fingertips, I was able to connect with her. I won't say what social media. I don't need everybody flooding the timeline just yet. Dr. Sylvia will probably get me for putting it on blast like that.
She already tilted her head, girl.
Hey, I know. You saw the head tilt, right? I was like, let me shut up. But Dr. Aisha, I was able to connect with you because it's all about, being able to have reliable resources. As a pharmacist, is still the most accessible healthcare provider. So I was able to connect with you and ask you this specific question about this medication and side effects and what she was concerned about. And everything you said, still having the basic foundation, the knowledge, I was able to trust what you're saying. It's true. So having these trusted resources, I too may have to reach out to another pharmacist, but who specializes in another area and to reel it back in. So I just want to thank you for helping me to get that information to my aunt. And she was grateful as well. And she was
glad to hear.
Because her doctor told her what we needed to do. And she was like, I need to talk to my niece. And I was like, well, I need to go talk to Dr. Aisha. So she was able to then go back and trust her physician because we were able to back up what was recommended for her. And there's so many side effects with chemo drugs and things
Yes.
like that they have to take other drugs to mask side effects that may pop up with the drugs.
Exactly.
And tell us a little bit about that complexity. I mean, I think steroids, taking steroids before going into treatment helps to mask some of those side effects and things like that. So just the complexity of it. What would be something that on a typical day for you that you'd have to counsel? And because this is breast cancer, maybe a breast cancer patient, what would that look like?
Mm-hmm. So definitely steroids and other pre-medications are essential. So I know we always think of cancer chemotherapy, but there's a whole bunch of other medications that a patient has to get before they get their chemotherapy. Mm-hmm. And some reasons could be due to the fact that it has a very high risk of causing a reaction. Mm-hmm. So there's a lot of chemos out there that can cause some very serious reactions, and we try our best to prevent it from happening by giving medications like steroids or Benadryl. Pepsid is a good example. We try to combat that as much as possible. Not saying that it won't happen, because it still does. Mm-hmm. But we try our best with that. Also ensuring that patients have appropriate growth factor support, because I'm sure, as you all know, chemotherapy is notorious at causing myelosuppression or low blood counts. Mm-hmm. So for certain chemotherapy regimens, some are very notorious for just knocking out, like hitting your bone marrow really hard and affecting your white blood cell counts that protect you against infections. Mm-hmm. So we have to make sure that patients are getting appropriate growth factor support. They're getting the appropriate pre-meds depending on the chemotherapy. So for breast cancer, common drugs that I think about that cause infusion reactions are like paclitaxel, docetaxel, which falls under the class of taxanes. And then another regimen that's commonly given is called dose-dense AC, which is like an anthracycline, like doxorubicin, with cyclophosphamide.
Ooh, she talking that stuff. Uh-huh. Come on.
And that one patients get that every 2 weeks for 4 cycles, especially if they're early stage breast cancer. And that one is hard on the bone marrow. Mm. So we have to make sure patients are getting the appropriate growth factor support to prevent them from becoming neutropenic and at high risk of infections. Right. And also, as you know, chemo, a lot of patients are always weary of nausea and vomiting. Mm-hmm. So we try our best to ensure that patients are getting the appropriate antiemetics before their chemo to reduce that risk of nausea and vomiting as well.
So a lot goes in. It's not just one pill, go to the pharmacy and you're done. This is a entire process. It is really covering all preventative medications, the actual medications, and then meds for after. I mean, yeah,
exactly.
It's a whole process.
And y'all, this was why, I think that was a great explanation about being immunocompromised. And, when the booster first came out, these people came up and said, I have Barrett's esophagus. I have acid reflux. I take blood pressure medicine. And I'm like, I'm sorry, but you're not immunocompromised. And are you an active cancer patient? Are you, those are the people. And it's for the reasons that she mentioned, how it can suppress those things that help our immune system fight off viruses and disease. So
exactly.
And shout out to Dr. Courtney. Didn't you just get your booster today?
Sure did. Good old Walgreens. I did. Awesome. And shout out to Dr. Andrew if he's listening. He was the pharmacist that gave it to me. And of course, he's from not New Orleans, but from Louisiana. So we had a great conversation today. And he was very interested in watching the show. I hope he gets a chance to watch it, because I told him how we're all in non-traditional roles, and what super friend we were going to have on the show. So I hope he's enlightened and can bring the information back, to his team. So yeah, I got the booster today, feeling great. So I'll let you know how I'm feeling tomorrow. If I'm not expecting anything. I did go.
Which one is it? Is it Moderna?
Moderna.
Oh, okay.
Moderna.
I had Moderna Friday, and I slept all day Saturday.
Really?
Great.
I had
Well
my
rested.
Pfizer booster at the beginning of the month, and I didn't miss a beat.
I didn't like feel sick or anything. I didn't have chills. Now my mom, she had the Pfizer shot last, I believe. And
The
she had
booster.
chills. Yeah, the booster, I'm sorry. And she had chills and a headache. That lasted like 24 hours. I didn't have chills. I didn't have
So
a headache.
everybody's different.
Yeah, I
Yeah.
just was just like wiped out tired. And I just slept and I was fine. I took Tylenol just to be on the safe side, but no fever or anything like that.
Awesome. But yeah.
So, Dr. Aisha, is there any advice or something you always say? I don't know if you're how much direct contact you have with people that are going through cancer or breast cancer specifically, but is
Yeah.
there any just general advice? Say it's a newly diagnosed patient. What kind of advice? If Courtney's friend's sister reached out to you, what kind of advice would you give them?
I would say trust the process. I know it's scary when you get the diagnosis of breast cancer. It's scary to know, am I going to lose all my hair? Am I going to be feeling horrible? Am I going to be able to eat, the food that I usually love to eat? Trust the process. If something is unbearable, don't be afraid to speak up. The doctors and the team is wanting to do their best to make you feel as comfortable as possible. So if you're feeling really tired from the chemo, you don't know if you can go through it any further, just be vocal about it. And advocate for your health. If there's something that you don't understand or you want to know what your options are, make it very clear.
I love it.
Thank you.
Do most cancer treatment places or hospital systems that are treating cancer, do most of them have a clinical oncology pharmacist, or is that still a kind of a novel role?
No, most major cancer centers do have a whole team of pharmacists that are involved in managing patients on chemotherapy. Perhaps there might be like some small private doctor offices that might not, but I don't think that's very common. I think most cancer centers, you'll see a good team of pharmacists.
Awesome.
So I guess it's Dr. Sylvia and I have discussed this. We've talked about receiving the HPV vaccine.
Oh, yes.
Gardasil.
Mm-hmm.
So I made the decision and I had my son vaccinated.
Wow, that's great.
12 or 13.
Huge.
That's great.
And I really kind of fought back and forth about it. I wasn't sure if I wanted to do it, to make that decision for him. But then I was like, I talked to his pediatrician and I felt it was the best thing to do.
Yes.
My question is more, I guess, tailored towards a crowd of our age who has not received the vaccine.
I had mine.
Well, thank you.
It was before I was 27 when it came out, so I had it.
Wonderful.
Yay.
That's great. So for someone who is more mature than 27, in their I guess 40s, because is the cutoff like 45?
I think it was 45, but I think they might have extended the age.
They did, especially in men. I don't know that it's extended all the way up for women, and so a lot of insurances won't pay for it.
Yeah.
But
what kind of advice would you give someone who's considering it at, like I said, at a more mature age?
Honestly, the way I see it, if there's a vaccine that can prevent you from getting a cancer, I would take it. It's a no-brainer. That's how I see it. I know that, they might have their recommendations, but honestly, the reason why when it first came out, they had age restrictions was they felt like maybe after a certain
27,
age, it's kind of pointless.
Yeah.
I guess depending on the type of sexual history you have.
Lifestyle.
Yeah, exactly.
They were saying you've already been exposed, so your body probably has what it needs to fight it off. But I just feel like there's so many different,
there's so many different strains, and even when Gardasil came out, it only covered like four of them. Now it's 10, I believe.
10 or 12.
I gotta get it again.
Yeah. No, they don't say you need to get it again. If you've completed the series, you're done.
But yeah, I think it's a no-brainer. Anything that prevents you from cancer, I would get it hands down.
But these conversations get harder with a lot
And
of people.
it's expensive. Let's talk about it. It's like almost $300 for one shot, and you need 2 of them. So that's a lot of Christmas presents. That's a lot for somebody's budget.
Yeah,
I don't
think you and get the wig. I'm gonna need you to go get this shot.
That is a real barrier. That's true. Then also, it was controversial when it came out. Right. I remember the governor of Texas said it's going to be mandatory for all 9-year-olds or 11-year-olds.
Oh, wow.
You see what we're going through now with the COVID vaccine? Imagine that 15 years ago. So that created this political component that didn't really need to be there. But
and also there was a concern, mothers, they didn't want to give the wrong idea to their daughters,
right,
by recommending the HPV vaccine. So lots of controversy. But honestly, from what I'm seeing, HPV, it causes some serious cancers.
Exactly.
It can cause, it's one of the number 1 causes of cervical cancer. And we see a lot of young women come in with it. And also head and neck cancers, which can be.
Yeah.
Thank you. I mean, it's an honest conversation to have. Like I said, I was on the fence. Yeah, I was on the fence for my son, but I was like, I'd rather take this step now. You know what I mean? So.
And condoms don't necessarily protect you from HPV. So that's the other missing piece. So yeah.
Agreed.
Good conversation.
Okay, so with everything that you're doing, Dr. Aisha, what is Dr. Aisha doing when it's time to take the white coat off? What are you doing for your own self-care? We're big on self-care.
Yes.
So, and in order for us to serve our patients, we have to take care of ourselves
I agree.
well.
I agree 100%.
What you doing down there in Florida?
I'm gonna be honest. During pharmacy school, even in residency, I wasn't focused on self-care. I was busy focused on trying to, get a really good grade on the exam or trying to be a stellar resident. And after finishing residency, I realized, the best way to be able to take care of others is if I take care of myself first.
Absolutely.
So what I like to do is I love working out. Okay. I'm able to burn a lot of steam off with that. Especially now, burnout is a serious topic in the pharmacy world right now. Yes, so working out, lifting weights, I love doing that. So that's part of my self-care routine. I'm trying to meditate more. Yeah. I'm trying to learn to meditate. So I've been trying to do that and trying to read more because, the last couple of years I've been reading books, textbooks.
Yeah, actual books. Yes.
Yeah. So now I'm trying to read books, learn more. Audible is awesome. For that. Yeah. Because I have to commute to work. So I just, pop up, a book on Audible and listen to it while I drive to work. I learn so much. It's awesome. So I'm just very dedicated to self-improvement, self-development, and I'm so much happier for it. And I feel like I'm able to take care of my patients better.
Yeah, it shows. I mean,
okay. I feel like that self-care it evolved into self-development. My weakness is that I take on too much, how we say that in interviews. But I mean, the working out and healthy habits. But I just want to reiterate that giving yourself time just to be is huge in general. And without a goal in mind, outside of just pouring back into yourself.
Yes.
So that's a lesson that I think it took all of us, Three Friends Talk, a long time to learn. And so, okay, Dr. Leah and myself.
It is taking long.
So yeah, to just be with yourself, and I love it. I love everything you're doing.
Mm-hmm.
Thank you.
What?
Continue.
Oh my gosh. Okay, so what is next for Dr. Aisha?
I can't.
What is next? That's a good question. I feel like it's been so hard for me to look at the future with this pandemic. I'm just kind of taking every day, one step at a time, trying to find, unique ways that pharmacy can be, even more involved in helping patients. Like right now I have students that rotate with me, and I've been noticing that, I feel like we need more pharmacy involvement with, patient education. So, or, at least like a handout that can specify to patients what to expect. Because I feel like one thing I've noticed, a lot of patients when they're about to start treatment, they're scared. They're like, I don't know what to expect. Why do I have to come in for all these labs? Why do I have to do this? Why do I have to take this med? Why do I have to take this steroid? So I actually had one of my students create like a patient education handout that kind of spelled all that out for the patients, and they loved it. So, there's so many unique ways that pharmacists can be involved in the cancer setting or the oncology setting. So I want to be able to help develop that and improve that. For MsRxGeek, definitely the podcast. So it's going to be called RX Geek Podcast.
Okay.
Oh, we'll be on the lookout for that.
Yeah,
right.
So I'll try to have it on all platforms. And, just to continue to motivate and inspire. I want it to be a platform where people are comfortable talking about what's hot in pharmacy or what's hot in healthcare. I wanted to go into vaccines, but then I was kind of like, oh man, there's a lot of controversy with vaccines right now. So
it'll be good conversation.
People are very passionate about it, from both sides. So
do it.
I like the idea that you're going to try to make pharmacy hot. Oh yeah.
Yes.
Hot and spicy.
Yes. I want people to know that, I want people to know what we do. We're not just sitting behind a counter or behind a computer, just, doing nothing. There's so much going on up here to make sure that patients are getting safe and also effective medications.
That sounds exciting for this podcast.
We're really excited. We can't wait to support it and blast it out on our platforms and to our list. So let us know when you're ready.
Yes, and my co-host is actually my husband. So he's a pharmacist. He's a pharmacist as well.
Perfect.
So yeah.
Is he in oncology as well?
No, he actually works in the emergency department.
Oh,
so very, very different.
Very different.
Yeah.
I love that.
That would be a great conversation to get both perspectives, right?
Right. Yes.
I would love to. Yeah, I don't think we interviewed an emergency room pharmacist, so I'd love to get that perspective.
Oh yes,
if he's open to it.
Oh yes, he's definitely open. He loves interviews.
Well, thank you for the plug.
To know.
Yeah, I'm gonna shoot my shot. Well, this has been quite refreshing. I know that the future of pharmacy is bright. We're the dinosaurs, and we look to.
I'm a dinosaur.
Wait a minute.
Yes. I didn't know we were dinosaurs.
She said she graduated. She was in pharmacy school in 17, and Dr. Leah said I've been practicing for 17.
I understand, but
that means Leah's a dinosaur.
I don't need to be aged.
Y'all graduated the same year.
Girl, I'm not claiming dinosaur.
Can I have the floor?
I don't need to be aged.
Dinosaur.
Okay, I'm sorry. The future of pharmacy. Let me just squash the old guard. The future of pharmacy is bright. I'm just very impressed and happy to meet you and excited by all the things you're doing. And I can't wait to see all these things come to fruition. And I feel better that our patients are being treated by someone like you.
Thank you. Thank you so much.
Yes. Keep up the good work.
I'm blushing.
Keep trailblazing. Yes.
So for our friends out there, how can they connect with you?
So they can follow me on Instagram at Miss.RxGeek. A lot of people send me DMs on that page, asking questions. I try my best to respond to all messages. And also my website at MsRxGeek.com. Lots of great content there, especially for pharmacists or pharmacy students. Especially now that it's like residency application time. So there's a lot of great content out there for them, like how to prepare for interviews, how to be, an outstanding residency candidate. Lots of great stuff there to help everyone.
Awesome. Love that.
Thank you.
I love it.
All right.
Well, to our Three Friends Talk family, we will not be live next Wednesday. We will be at Gold Table Talks on the 4th. So
we'll university's homecoming.
We'll make a event on Facebook. You can RSVP to, so you can get that live link. Of course, we're going to go live and include you in that. So we can't wait to see y'all Thursday. And thanks for rocking with us. If you would like to buy us a coffee, feel free to do that to support the show and catch us on, what is it?
Freely TV every Thursday night.
Yeah.
Channel
y'all
100.
Download freely. Y'all do that.
Channel 100 at 9 p.m. Central, 10 p.m. Eastern.
All right, guys. Have a wonderful night. Stay safe. Get your booster.
See you next week.
Thank you, Dr. Aisha.
Thank you.
It was nice to meet you.
It was nice to meet you all. You guys are all lovely.
Thank you so much.